I can't begin to count the number of instances in which nurses have made a positive contribution to my journey. They are the mainstay and the key support for my journey in addition to my family and close friends. In fact, many of the friends that I have known over many years who have stepped up to the plate to give me extraordinary levels of assistance in their day jobs are nurses as well. So from the day I was diagnosed to the present day, nurses have been with me all the way through, both personally and professionally. There are so many instances in which nurses have risen above and beyond the call of duty to assist me through my journey. In particular, the times when I was starting chemotherapy or starting a new leg of the journey, nurses have been key in seeing that I was not just comfortable as a patient, but that my human needs were identified and addressed. And that's no mean feat for people who are very, very busy on the ward on a regular basis. But they always took the time to say my name, to speak to me personally, to make sure that I was cared for in a technical manner, but to do so with compassion and caring that I have found really outstanding. Let me say that prior to my introduction to healthcare as a patient, I was generally aware of what nurses did, and certainly from my medical training I was aware of the kinds of work that nurses do. But until I was locked in the bed, I had no idea how critical the role of nursing is on a 24/7 basis. You know, there are many professionals who are involved in the care of patients. Doctors, pharmacists, therapists, X-ray technicians of very many sorts. But the person who is there 24/7 with a call bell to go with it is the nurse. And that to me was a revelation, because I had not quite realized how crucial the role of nurses are to the care and well-being of patients on a universal basis within our healthcare system. The role of nurses that I've experienced has been somewhat varied. There are many transactional items that need to be done on a daily basis. At the start of a shift, they come in and they take your vital signs, make sure that you've survived the night or the day or whatever it has to be. Make sure that you've got your medications, that you can take your medications, that you understand what the issues are, and if you don't, they make sure that you've got the right professional to speak to you. They do everything from large to small. They make sure that an emergency is identified and call the physician if necessary, and in the meantime they'll make your bed and make sure that your lunch tray has been taken out into the hallway. Myriad of jobs, some of which are so highly skilled that I cannot begin to describe to you my admiration for the quality of work that is done. In my so far limited experience, I have seen nurses work very hard, often working hard shift after shift, day shift after night shift, in order to make ends meet, support their families, make the best use of the education that they've got. But often they have higher aspirations for additional learning, additional training, a career shift of some sort, not to leave nursing, but to expand upon and build upon the education that they have received and their work experience, which is so valuable. It seems to me that scholarships would greatly assist in helping individuals see an opportunity to realize their dream of higher education, to build on the experience and training that they've already had in a way that can help them identify the best possible ways of meeting the needs of patients and their communities. My experience as a patient has been a very useful one, very invaluable one, in seeing the role of nurses and the importance of the healthcare system from a different perspective than one has as a medical provider, which is a very different kind of experience. In my view, nurses are really a key mainstay of any healthcare system, especially a publicly funded one. And number two, I see nurses as being the ones who are there day in, day out, night in, night out, and therefore have a breadth of a wealth of wisdom that has come from that intensive interaction that I think the system needs to make more use of, and the individual nurses ought to have an opportunity to capitalize on in the ways that make the most sense for them. Nurses have a very important role in being a key liaison between the patient and the system, between the patient and their care provider, whether that be the doctor or the technician or the pharmacist. A role that, in my experience, they have played extremely well. Let me also say that there is a lot of technical knowledge that I have seen nurses exhibit that has been a revelation to me. It's not a job that is easily done, certainly not a job that I could do. Everything from understanding what the main effects and the side effects of different chemotherapy regimens can be, to operating the infusion pumps, which is an advanced art that I cannot describe, being key to the welfare, the mental well-being as well as the physical well-being of the patient. Because if you're not getting the meds at the right rate, at the right time, in the right dosage, the only one who knows that, potentially, is the patient when they get sick, or the nurse who's in charge of giving it. And it speaks volumes to the role that nurses play in being that real linchpin between what the intention of the various providers are and the delivery of care at the bedside. I nearly fell out of bed when the nurse said, "I'm here to make your bed." A nurse is going to make my bed? Like, they shouldn't do that. They shouldn't have to do that. And fortunately, one day a volunteer made it. The rest of the days I make it. That's okay. I can do that. But you shouldn't have, from keeping the patient alive to cleaning up the food tray. Only other thing that I would add is that I have always been struck by the fact that nurses have always seen me as a person, as a human being. I'm never just a chart number. I'm a chart number when they've got to check the meds against my ID bracelet, which they do with a rigor that I find astounding. But they always call me by name and they mean it. They look me in the eye, they ask me how I'm doing, and they really are sincere in wanting to know how I am.
It's not just a question.
It's not just a question, it's a genuine inquiry, person to person, and that makes all the difference in the world to someone who's sick and just wants to get better.